A healthy future should not be dependent on whether you're literate or not.
Nepal has one of the highest maternal mortality rate in the world. Each year, over 1,000 women die due to pregnancy and childbirth complications. A majority of these deaths are preventable. Working at the Regional Health Training Center in Pokhara, I was consistently reminded of this distressing situation. Therefore, I came to the University of Newcastle, Australia for the PhD program, wanting to investigate the potential pathways to improving maternal mortality rate in rural Nepal.
When I first met Binod, it was apparent that he was passionate about improving the health of Nepalese people, and in particular maternal and child health, but he wasn't sure how to go about doing it. I'm afraid I had to say to him, "I'm sorry, Binod, but I don't know much about Nepal. Could you tell me about Nepal? What are the key problems, and what is Nepalese life like?" Roger, Binod said, "When a lady gets married, she goes and lives with her husband's family, and all the decisions about her pregnancy will be made by her husband's mother and father. Her husband's mother will make all the antenatal or other care arrangements to do with the pregnancy. But anything that requires financial assistance, that is the domain of the father-in-law. However, the lady will not be able to actually tell her husband, her mother-in-law, or her father-in-law that she's pregnant."
When she gets bigger in size, the family member will know that she is pregnant.
So I said to Binod, "Tell me about Nepal. What do people like doing in Nepal?"
They are fond of singing.
Singing?
Yes, and particularly the women, when they have any opportunity to be together amongst themselves. For example, when they are going together to fetch water, to collect firewood, or to work in the field, they start singing. They use the satiric message in their song.
So they're allowed to say things in song,
yes,
that they're not allowed to say in ordinary conversation. And therefore it seemed appropriate for us to use songs to try and improve maternal mortality in Nepal. Once we decided upon the idea of using songs to communicate knowledge to the community in rural Nepal, we had to decide on exactly what ideas to communicate. And for that, we approached Professor Henry Murray, who's head of our Department of Obstetrics and is very experienced in antenatal care, particularly in developing world situations. He emphasized to us 5 different things that we should focus on. Firstly, that a pregnant woman requires substantial rest during her pregnancy, that she also requires good nutrition during pregnancy with regular meals. Thirdly, she needs to go to antenatal clinics to have her blood pressure and her blood sugar measured to detect hypertension and diabetes. Fourthly, she needs to have a family who plan for the delivery of her baby, so adequate transport to get to the right place for care. And finally, she needs to have her delivery performed by a skilled birth attendant. The song competition was expected to lead to perhaps 3 or 4 teams of singers and dancers, but in fact we had 26 groups present their work. The plan had been for the local songs to be judged by school teachers and other elders, and then for the winning songs to be given to a group of travelling minstrels called Gandaba, to be taken to the individual houses. However, when the school teachers who were judging the competition heard the songs and realized how important they were, they said, this is not a job for the Gandhabah, this is a job that we should undertake ourselves. The winning songs were then learnt by the travelling team in rehearsals, and a route plan for how the team would process through the villages to ensure that all of the houses and all of the villagers had an opportunity to hear the songs and participate in the dances. The team would be preceded by a town crier who would yell out across the valleys, letting the villagers know to come in from the fields to hear the songs and see the dancing. They conducted 80 different performances, and 2,400 villagers participated in singing and dancing at the different sites. We conducted our research in 2 areas that were geographically isolated within the hilly districts of Nepal, a control area and intervention area. Surveys were performed before and after the intervention to see just what effect the song program and also the use of our posters had had on the level of knowledge in the community.
After collecting post-intervention data, we analyzed, and results are exciting. The people in the village were able to gain knowledge regardless of education status, economic status, and gender.
So the songs had been able to transmit knowledge regardless of the state of education of the individual recipient of the song. This is very special and important, and means that this type of technique could be utilized in developing countries where levels of literacy are low. The other thing that surprised me was that the level of knowledge amongst men and women regarding antenatal care was very similar before the intervention. So both men and women had very little knowledge about antenatal care. After the intervention, men and women increased equally, demonstrating the ability of the songs to cross the lines of sex. 12 months after the intervention, a 3rd survey was performed, and this showed no loss of knowledge at all on the information covered within our songs. Our data showed that all of the concepts that were included in songs were taken up and internalized by the villagers as they sang and danced with the songs. The results from our program are quite dramatic. Singing and dancing in rural Nepal is clearly a wonderful technique for transmitting health-related knowledge in that particular setting. We hope that the government of Nepal will note our results and perhaps arrange for this type of program to be rolled out throughout rural Nepal. However, globally, the work also has key messages that to transmit health knowledge to illiterate people, there are approaches that can be successful. A healthy future should not be dependent on whether you're literate or not.